being able to collaborate with all of these people, with all of these ideas, has been super fascinating as being part of TRC4. I think the most important C in TRC4 is collaborative or collaboration. And I mean, being here today and even last year, now this is the second year, I have met AI engineers who are making AI programs, and as a trauma surgeon, I have no idea about any of that stuff. And so with these great minds, and also the minds in the lab, right, there's people who are 3D printing muscle, where rats who are no longer walking are walking. So it's a great start, and it's a great collaborative, and I think listening to all these people and all these different specialties, it's generating, and you can hear it, all the whispers and the conversations. It's fascinating because people are coming up with newer ideas and newer collaborative teams. And the UT system is a broad system within Texas. I don't think any other state can probably do what we're doing right now. I am about 2 years out from fellowship, so a very new attending, trauma surgeon attending. And I am currently down at UT RGV, which is at the Rio Grande Valley. It is pretty much the first medical center down in the valley under the UT umbrella. So if you can imagine decades of care without any sort of academic medicine, there's a huge need for it, right? And so everything is new down there, to where just today, through TRC4, I met other collaborators, other researchers who are new to the area and building their own research lab down there. And again, through TRC4, we are able to start collaborating and coming up with ideas and generating more project ideas to benefit the trauma care down there by just meeting each other and sharing these ideas. And it gives us an avenue because for so long, you know, trauma surgery, I go to the hospital, I take care of my patients, and I go home, right? And there's other people out there doing their own specialty, and everybody for a long time have been just kind of honed in and tunnel visioned into their own specialty. And there has been some collaboration, but not like this. To again, where you see, we have computer specialists down at UTRGV who are now interested in specializing in healthcare, right? To engineering those things that we also need. But they have no medical background, no health, it's just computer science. So those things are also very helpful in the interdepartmental aspect of creating something so new, which is down there. And I feel like the more people know about what we're doing, it's going to take some time for us to show output. But the thing is the more we collaborate, the faster we will see change throughout, you know, trauma care in Texas and the world, actually. Because for a long time, the research world can be very slow. And developing projects and new ideas through the research world can be very slow, whether it be bench work or clinical, you know, having multi-center studies. It can be a very long and drilling process. But with all of our powers combined, you know, all of our specialties combined, we can move forward and actually take action faster by doing that. And that's what TRC4 is, and that is powerful. And like Dr. Stewart said today, you have to have a bias for action, and this is what that is. Everyone brings something so important, right? Not everyone sees the patient who's at bedside, who's burned, right? And the anguish it takes to transfer someone to another center, or having someone from another center call you saying, hey, I don't know how to take care of this patient. How do I take care of this patient, right? There's so many stories out there, and the people here have different perspectives for all of these problems that we still have in 2025, right? So I would tell them, come, listen, ask questions, and then you will understand where we're coming from. Because if you don't know and you're not in healthcare or even at bench work or had anyone in the hospital, it's very hard to comprehend because it's so complex. right? It hits so many different levels. So I invite them all to come.